And what else would I be doing on a beautiful Saturday morning right before Christmas than to create content for all of you, for everyone to enjoy and benefit? Today, I'm going to address a question sent in by an anonymous user or poster in the Thriving Urology Practice Facebook group regarding his employment situation and work RVUs, as well as multiple modifiers that will be involved in this discussion. For those of you who have joined us recently, thank you so much for coming, and I would like to know how you found the Thriving Urology Practice Facebook group. In case you don't know, my name is John Lin. I'm a urologist in Gilbert, Arizona, also your humble host of the Thriving Urology Practice Facebook group, where we crowdsource practice management solutions for everyone's benefit. Welcome to the group. We are very excited to have reached the 2,500 member mark. We have just exceeded the 2,500 member in this group. So super excited. Thank you so much for contributing to the content. And let's get right into the question that somebody asked anonymously. And by the way, you can ask questions anonymously if you want to protect your identity, your sanity, your safety, whatever it may be, or if you are both working in the same group, and what you say may impact on your situation in an unfavorable fashion, if you will, or if you're sensitive to that situation. So let's get into it. This is a question that was asked by a member a couple of days ago, and he wrote, or she wrote, I don't know who it is, or his or her gender. I'm currently a hospital-employed urologist. My contract states that I'm paid per work RVU. In general, if I code for a case, then I'm paid those work RVUs. We now have a new president of our medical group who wants to implement the multiple procedure reduction, also known as Modifier 51, to any applicable surgery. This is going to lead to a significant reduction in my work RVUs. For example, if I perform a radical prostatectomy with bilateral lymphadenectomy, I would get paid full work RVUs for both procedures. But under the new terms, I'd only get 50% for the lymph node dissection. The new sheriff is telling me being paid in full for both procedures is a violation in fair market value, because the hospital only gets paid 50% for the second and subsequent procedures. This seems like an excuse to cut physician pay because I'm paid per work RVU, and this is really a hospital reimbursement issue. For those who are hospital employed, how are you compensated for multiple procedures? Full work RVUs for all procedures, or 50% reduction for each additional procedure? Thank you in advance. All right, let's get into it. As with anything related to the crazy world in which we live, billing, coding, serving the United States population in healthcare, it is complicated, especially if you deal with a third-party payer system, which is what Medicare does for us, which is what private payers do for us. And most of us in the Thriving Urology Practice Facebook group are involved in a third-party payer scheme. And this question strikes at the heart of multiple issues. First of all, we'll address the multiple procedure reduction. This is something that is actually very standard operation, very commonplace, not just for Medicare, but also for all private payers. For Medicare, you really don't need to apply that Modifier 51. Medicare will automatically apply the Modifier 51 for you. And typically, the way it works is that the procedure, if you do multiple, for instance, radical prostatectomy, if you perform prostatectomy and lymphadenectomy, these are two separate procedures, and there are two CPT codes, one for each. Normally, when you bill for these procedures, you would code the highest RVU procedure first on the first line of your claim, followed by the lower RVU line item. And in this case, radical prostatectomy will be first, lymphadenectomy will be second. It is commonplace to impose a 50% reduction in the work RVUs for the subsequent procedures on the same claim when you're performing multiple procedures in that same session. This has been the case for many, many years. And what your new medical group president is telling you is not trying to cut your payment. I think initially when they hired you, maybe the contracting says that you're paid for the full value for both procedures. But I think for most of us, the subsequent procedure is reduced, unfortunately. So what the new president is telling you is not something that he's drumming up to try to cut your payment unnecessarily or unjustly. This is really the case. Now, let's address the issue of fair market value. You mentioned someone said violation of fair market value. Well, it's not violation of any fair market value. The 50% for subsequent procedure reduction is truly the industry standard. So let's just get that straight. That is normal, okay, in today's environment under which we operate for most urologists, for most healthcare physicians, providers. So there's no violation of fair market value. And the fair market value is really what urologists dictate in terms of whether or not we want to accept the terms that are being offered to us. A lot of people think fair market value is dictated by some survey or whatever it may be. Well, how did those surveys come up with those values? Somebody has to accept those values, right? Somebody has to accept, okay, we will take this much. And that's how the standards are set. That's how somebody created those metrics or standards. To change the fair market value, you, the urologist, will have to agree to those terms. And if you disagree, if you know your worth and you value yourself at a level that is higher than whatever the survey fair market value is, you in turn reset that value at the value that you are willing to take for the service or for the employment contract that is being offered to you. So a lot of people think fair market value is kind of, our hands are bound behind us. We can't make any changes. I think that's a bunch of hogwash. You determine the fair market value. If you don't think it's fair, you simply don't accept it. And if you are able to negotiate at a higher term, then those survey values will go higher. And that determines the fair market value. So the fair market value is what the market will bear. It's not based on some survey standard. It is what you're willing to take and what is agreeable between you and your employer. So you need to understand that. A lot of people think, some standard, some surveying, some company created this and the hospital is using whichever company data, and that is what they're offering. So this is something called an anchoring bias, if you will. The hospital will throw out this anchor, and then everyone negotiates around that anchor. Well, that's a human cognitive bias, and you need to be aware of that when you're negotiating your contracts or any contract, any negotiation. So don't fixate on the value that the hospital is offering. Know your personal value and what you're willing to do for what amount, whatever the work that is asked of you, okay? So you determine the fair market value. You and the hospital or your employer determine that fair market value, not some survey company. Get out of that mindset, know your worth, and accept only what you're willing to take, okay? Don't let somebody else dictate your worth. Okay, let's get into it. Somebody in the answer to this question said that because the hospital or the new employment model is going to reduce your subsequent procedures by 50%, be aware that there are other modifiers that can be used to increase the value of your services. For instance, modifier 22 for your CPT codes. If you perform more work than is typical for a particular procedure, there is a modifier for you to append to that code, the base CPT code, to show that you did more work and you deserve to be paid for that additional work or service. I understand this. So those of us who realize that we are all being gaslighted by the CMS physician fee schedule, okay? Somebody else is telling you how much your work is worth. I totally understand that. But within the structure, you have some control to show that whatever service that you provided, whatever surgery that you provided, require additional work effort, additional time, additional mental capacity, additional physical work, and you should be reimbursed more for that. So if you're hospital employed, you're counting your work RVUs, make sure that the hospital is crediting you appropriately whenever you use modifier 22 for additional work effort involved in the performance of that procedure. In addition, there are cases where when you perform the same procedure on both sides of the human body, you may be remunerated for doing the procedure on both sides. Modifier 50 for bilateral procedures. So make sure that if you are doing the procedure on both sides of the body, that you are being appropriately credited when you perform those procedures. So just because you're getting that 50% reduction, which by the way, it is standard course for third-party billing in the United States, just because you're taking that reduction, make sure on the other side that you are being appropriately credited for modifier 22 procedures and also modifier 50 procedures. So make sure you understand these rules. And one of this modifiers is something that I cover in the Urology Advanced Coding and Reimbursement Seminar. I'm one of the speakers at these seminars, and I'm not part of PRS Network. They just simply hire me when they have these seminars, and I present to the audience. So I don't really gain anything if you attend or don't attend. I'm going to be paid anyway, no matter what. So I'm sharing this with you because this is something that we cover: modifiers 51, 50, 22, 57, 59, XU, XE, XP. And there was an audience member at the Urology Advanced Coding Reimbursement Seminar last week, as a matter of fact. He said, "Oh, I'm hospital employed. A lot of this stuff doesn't apply to me." Case in point, what are we talking about here? We're talking about modifiers. We're talking about work RVUs. We're talking about CPT for this hospital employed urologist. Just because you're hospital employed does not mean that you can just go la 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 la. I don't need to know anything. Nothing could be further from the truth. If you provide healthcare in the United States and you are involved in a third-party payer scheme, you need to understand the coding and billing aspects of medicine, unfortunately. Modifiers, CPTs, work RVUs, total RVUs, work expense. It's unfortunate that we have to, as urologists, we have to go through 4 years of medical school after college, 5 or 6 years of residency, and sometimes multiple years of fellowship, just so that we have to learn more stuff like coding and billing to be able to practice successfully. Unfortunately, that is the reality, okay? Those of us who understand the rules and know how to apply them to your advantage, to our advantage, are the ones who are the happiest working in this third-party payer scheme, unfortunately. I say this, this is something that I tell my colleagues, and that is, your patient success depends on your success. And your success as a urologist, as an APP, depends on your understanding of coding and billing rules. That's just the sad reality of this third-party payer system. I think I've shown in just this one question why understanding coding and billing, even for the hospital employee urologist, is important. Modifiers. I mean, we're down to the level of modifiers. Why understanding modifiers is an important aspect of your practice of medicine. And for the hospital employed urologist, not only does understanding modifiers involve just applying the codes, on the back end, you need to somehow take account, because hospitals, employers are notorious for deliberate downcoding and not accounting for the modifiers that you apply to your CPTs. So that's a totally different topic. These are some of the things that we cover at the Urology Advanced Coding and Reimbursement Seminar. And actually, there's another UACRS seminar coming up in New Orleans in January, at the end of January. So it's not too late to sign up. And I will put in the video description or in the comments a discount code for you to sign up. Big discount on the upcoming UACRS in New Orleans. I just booked my flights, so if you're there, I will see you there. Let's get a selfie. And by the way, speaking of selfie, thank you so much for all the love that I received at the UACRS in Las Vegas last week. Thanks for the selfies, and I will see you in New Orleans. Any comments and questions? As usual, please leave them below. Agreements, disagreements, I love dissenting opinion. Thank you so much for the privilege of your time. Please take care of yourself and take care of each other.